I just wanted to thank you for being here. The purpose of today was really just to, of course, get to know you better because I'm very thankful for what you have done. And also I wanted to, understand what helped you, what didn't help you. Honest feedback is also always great. And then, your experience, so I can share with other students because I talk about how you should study, what you should do, but then when it comes from other students, it's so much more powerful.
Mhm.
Yeah.
So basically, most of my friends were going off like the seminar in Chicago in California,
Mm-hmm.
and I already had that book, but it was just so much, and I didn't want to like read it because it was just so much.
No, it's like this thick.
Yeah, and I speak 3 languages, and I found it really hard for me to like understand some of it. But then when I purchased like StudentRDH, it was like straight on forward, like it was
Right.
not very complicated or anything. And I just took my boards on Monday.
Oh,
Um,
wow.
I mean,
Congratulations.
thank you. I thought it really helped me a lot in like case studies. It was very helpful. Like it was just straight to the point. I really like StudentRDH. It really helped me with my
Mm-hmm.
board. And then like other sources out there are very expensive, but what you offer I think is at a reasonable price compared to what we pay for school stuff already. So I suggested that to most of my friends. And so my instructors were like, "Oh, okay, well, we're going to be introducing that then to the next upcoming class for them to use it." So that's the plan for them. But I really, really like StudentRDH. Like I did a lot of the practice. When you go, I don't know if you can see, but I have attempted so many quizzes, so many different things. But I really liked
So
it.
the quizzes again and again, you did it many times.
Yeah.
And
Well, the
yeah.
first time I attempted them was before I read the sections, just to see whether or not like am I good here or not. And
Mhm.
then after that, I've done that. Like I would take them, and then like a week or like two later, I would take it, but then I'll be forgetting like the questions again, and then I'll just keep going over them. And a lot of the things that was on the Nerd H actually showed up on the boards, and I'm very glad that helped.
Glad to hear. Wow. Well, I'm really happy that you found it through your friends, probably. Is that how you found about student RDH?
No, I found out about it through Facebook.
Okay.
There was a video where you were talking. I was taking pharmacology at a time, and you were
Okay.
explaining like how to differentiate like the endings and
Oh,
whatnot.
yeah, yeah, yeah. Okay, I remember. Yes, the hypertension.
So
How
I'm
do
like,
you know, this thing is,
so from that video, it helped me do well in my pharmacology like exam. I was like, okay, this is what I need to purchase.
that is amazing. Wow. So, yeah, I assume you did the free trial and you like pharmacology.
I didn't do the free trial. I just did it right away because like
Okay,
I
okay.
felt like the video was like enough proof that I can get if I can get through my pharmacology class, then I was like, why wouldn't I get through the rest of my boards?
Mm-hmm.
So I mean,
Fantastic.
hopefully I did well on my boards because like after I was done, there was like questions. I'm like, oh my god, did I
Yeah,
really?
yeah,
So
yeah.
I'm scared.
Great. Wow. Well, thank you so much for, first of all, to share your story, how you love student RDH, really, um, I obviously made it for the purpose of helping students because I was a student myself too, years ago, and I didn't really think there was something out there that I loved doing for boards review, or it was just a lot of money. So that was the whole purpose. And I'm glad we have students like you who are, justifying the, the time and effort it took to create it. Now, I want to know more about your boards now, since you took it, a few days ago. I want to understand how you went through it because a lot of students, we are right now, as we are doing this, what are we, March. A lot of students are actually taking in March, April, and May. Those are the highest months. So, some tips and things like that. If you are okay with that, I would love to start asking some questions.
Go ahead.
Great, great. All right. So first of all, let's start with the preparation. How long did it take you to prepare?
So the way that I did like the studying, I started. Well, I bought this in like August,
Mm-hmm.
I believe, or like I think August or September, and then I was just reading it, but I wasn't like memorizing anything. I was just like reading them or whatever.
Okay.
And then as I was like reading, I was focusing on the things I didn't know, and then I created like my own booklet that has all the stuff. And then the memory technique course that you gave me ideas of like, oh, how can I remember that and stuff like that. So that's what I did. Actually, I'll be right back. I'll show you something really quick.
Oh, of course. I am here.
I'm here. Sorry.
Yes. Oh, is that what you did, your own booklet?
Yeah, so you said that there were 4 main categories that we needed to focus on because I attended your webinar. You said radiology, pharmacology, community, and I forgot the last one.
Here, probably.
I don't remember what the last category was, but my main 3 that I focused on was community, pharmacology, and radiology.
Yeah.
So you told us to create our own memory technique, so I created my own.
Wow, you did fantastic. Oh, I love it. Can you tell me something if you can share?
Yeah, so beta blockers, it's to reduce the cardiac output is what we have, right? So I'm like, oh, well, beta blockers bring the beat down. So that was my way of knowing what is that.
Oh, I love it.
And then calcium channel blockers, they relax the blood vessels. I'm like, oh, well, you drink milk when you're relaxed. So calcium and milk.
Oh my God.
And then diuretics, I'm like, diced tomatoes, because like, you know, they're red and they squeeze things out. So I'm like, oh, they reduce water and reduce blood volumes. Sounds right.
Yes,
I really like that. It was really helpful and like drawing pictures and stuff like that. That was just really nice. And then I create like tables like this.
And what is that about? What is that about?
So this one is for like opioids, for example, like which ones were agonist and which is antagonist, because a lot of the questions were me, which one was antagonist, which one was agonist, and it was really difficult to remember if I didn't have this, but by just looking at the chart, like I was like, okay, well, this falls under the agonist, this falls under the antagonist.
Okay.
And then nitrous oxide, I just draw a picture.
Oh, just for fun, right? That's just, I mean, you know what though, those things like drawing pictures while you're studying, things like that are actually helpful. Why? Because in your brain, it creates like a memory saying, hey, I remember that I drew this here, and then you remember the context of it. So that all works. I love what you have done with, you know, the hypertension blogs. I want to now sit down and actually get more, so that I would love to just feed it back to our social media, to our students. And I would love to also just do, you know, a blog about it maybe, you know, if you have the energy to do that, you know, I would love to just feature it. And maybe video. I mean, I love it because, you know me, the memory course, you know, StudentRDH was big onto how to be efficient and all of that. Say, you know, what you talked about beats down, beta blocker. I mean, you do it once, there's no way I'm going to forget now. And there's no way students are going to forget. And you're going to do it until the end of the day. So I would love that. So yeah, I would love to request separately, you know, a time for us to do this, and then focus on also the blog if we can share the story.
Sounds good. I have no problem with that. I just wish I looked a little bit better.
I really think that's going to help so many people. So I'm loving that you learn through the memory course, you know, because so if people, you don't know what memory course is, it's a separate course that I created in StudentRDH that talks about how you can memorize things better. And I modified, of course, for dental world. I talk about it a lot. I lecture about it a lot. But, you know, there are some tips about how to memorize numbers, simple words, groups of categories, and what you have done is fantastic because you have applied that and put it in your own words, and everybody has a different way of memorizing. So I can tell you one thing 500 times, but that might not apply to you. So you came up with your own techniques, and that is fantastic.
Yeah, another thing was that that I thought was really helpful was like the second part of like the practice test with the case studies. At first I was like, oh, well, these look really easy, like on StudentRDH, but then when I went to take my boards, it was like very similar. So I was like, oh, okay. So I felt really prepared for that part.
Amazing.
case
So you're
study.
talking about session 2 in StudentRDH, which is the mock exam, but session 2 is all about the case studies of 4 different tabs. And you were comfortable going to the exam, or when you went to the exam, you thought it was easier because you practiced that way already.
Yeah.
I
So
mean,
yeah, that was
great. So you started around August. You know, I remember you sent me an email about an extension. So, you know, we did that. I remember that part. So, you know, you took some time. Was that on purpose that you wanted to study early, or you just was planning
so
to?
like I said, when I first purchased it, I was still taking pharmacology, and I wanted to take the course just so I can like see how pharmacology is going to help me in my class, and I did that, and it really helped me for my school time. And then I was like, after that semester was done, I was slowly trying to read them, but by the time it was January, I was not done with all of it, and I was really like scared that it wasn't like, you know, going to be enough time. And then you mentioned that there would be an extension. I was like, oh, thank God, I'm going to make it. So, so by mid-February, I was done with all of them. And I was planning on also taking my Canadian boards, but it'll be like in June. So I didn't get the chance to practice that one. But everything else I was able to go through. And then I remember doing a webinar, I asked you like, oh, is there going to be a lot of head and neck or biomaterials? And then I kind of, when I attended the webinar, I thought it was really helpful to tell me what to focus on, because I think it needs to push. One thing I think would be great that will help the program is if it had like an icon where you can read, because like if you're in a car and you're trying to listen from your phone, it'll be helpful. That's just one thing I wish that was on there.
You're talking about an audio.
Yes.
Okay, great. I mean, I love feedback like that. It helps me think like, what else can we do to make it better? And you're right. When you're driving, you don't want to spend time listening to the radio. You know, you have the boards to take. You want to be efficient, right?
Yeah, especially when like this is the only goal you have right now, and that's your main focus. You definitely want to be listening.
Fantastic. Great. I have some ideas now. I mean, it will be hard, honestly, to put this in a format when I'm talking like a textbook, because as you know, in StudentRDH, there's just bullet points. If I read that, everybody will fall asleep. And you need your own time to digest the content, but I'm thinking maybe what I can do is actually more podcast style when I talk about one concept today, without going the whole, like everything, maybe just hypertension. We're just going to do hypertension today, and I'll throw in some memory techniques and concepts and quizzes. So maybe let me think about that now. Great. So you took the exam very recently. What is the day before? Like, did you study? Did you relax?
No, I didn't study the day before, because I knew that if I studied the day before, I would confuse everything.
Yeah, you're right.
I didn't study the day before, and when I actually went to exam the next day, I was very relaxed. I didn't like freak out or anything. I was just like sitting down. I did all my questions, and after test, I walked out of the relaxed. I didn't have anxiety or anything. And then all these people would tell me, "Oh my God, I don't know how I did." I'm like, I don't know, if I don't have any feelings. Like, I don't know. I'm not freaking out where I'm like scared, but I'm also not happy because I don't know how I did. So
yes, you took the time to just relax, and I agree with that. Our brain doesn't need more the day before, because it's actually going to trigger more anxiety. And then after the exam, you felt kind of neutral, like, you know, you did well, but you didn't freak out either. And that's a good sign. And that's the truth, right? Nobody walks out the exam feeling like, I'm going to pass right now. Honestly, there are questions in there that you just weren't really sure about, right? Can you tell us a little bit more about things that were not exactly what you expected in the exam?
I don't remember like exactly what it was like those questions. I just remembering that when I first took the first section, there was a lot of questions that I flagged. And then I was like, oh my God, like, I don't know these questions. I've never seen them before. Or like there'll be endings of drugs that I've never seen before, and I'm expected to know what they're for, like stuff like that. I didn't know how to react or how to do anything about it. So I flagged them, and at the end I went back to them and I was like, if I change my answer, it's pointless because I don't know what I'm supposed to be doing. So I'm like, just process of elimination. Which one sounds best? That's how I dealt with those questions, because I didn't know how else I was going to answer them if I'd never like seen them before. So, and then by the time I got to the second section of the first 200 questions, because they divided 100 on 100 in the first part, I was like, I'm not going to flag any questions that look like that anymore, because it's just pointless for me to go back and keep trying to change. I was like, what's done is done, unless I knew like a question from before that I might have seen reading somewhere or something like that. But
all right, so I understand the strategy. So you started it and you were flagging a lot of things, because in the exam, we're talking about the NBDHE right now for those who are listening. NBDHE has a flag function when you can just say, it's just mark it for you, say, I'm going to come back. It's like a post-it or something. And then you started to do that, but realized there's no point because you don't really know anyways what to do afterwards. So you just kept going, right? So what happened when you didn't know something? You did just choose something and moved on?
I did. I chose whatever sounded good and just moved on. But I didn't like freak out or anything. I was just like, okay, maybe it's just one of those trick questions. And I was like, let's move on and see what else I can answer right. So
this is great. And actually, this is what I teach in the webinar too, because there are questions. I mean, we cannot get all 350 questions right. There is no way. Even a professor can sit there. We'll never get everything right. So we just need to understand that the game is just to get the majority right, and some we'll just have to let go, right? Because if we start freaking out about a question that we don't know, then it just triggers a lot of things that are going to affect even things that you know, and you don't want to perform like that, right? So I love what you're saying, because that's exactly what you have done. Amazing. Now let's talk about the big four that I talk the radiology, pharmacology, process of care, and community. Let's talk about community. How did you feel about community? Was there a lot of questions?
You know, one of the things I was really scared about was like a lot of index questions, like which index would be best. Surprisingly, there wasn't a lot of that, but when I was in school, they didn't really talk about any of the index. So I was shocked when I was like studying community that there were index. I'm like, where did this come from? Like I got 100% in that class, and I never even learned about that. And then like 2 questions that show up on the exam showed that I was very confident in there. But then they were just really long, like testlets pieces, and I was like not very confident in them at first. But I don't know, like if there was any other way of like answering. But I think I don't know, like the community part of StudentRDH was very helpful with the testlet practice.
Right.
It was really helpful like that.
Great, great. So yeah, for those who are listening who don't know what you're talking about, is that StudentRDH was trying to replicate the format of it. So we have a little tessa with like sentences about, hey, she went to a school, the school DMFT is this, and then we have questions. So that's kind of what you will see in the actual exam. So, I'm glad that you went through a community, you study your index, because those are actually really important. I mean, that they are everywhere. And you might actually, one day work as in the public health sector, and you will see them again and again, actually. And I remember when I did my rotation a long time ago, we were using indexes like that. So, all right. So what about radiography? People always say, hey, the radiograph quality is not that great.
For me, I didn't really have a problem with with how it was. I wish just like there was a little bit of practice on like how to tell what errors are present on panels. I think that's very helpful.
Panels, okay, great.
But other than that, like understanding like what KVP and MA does and stuff like that would really be helpful. Like the bulk of radiology that showed up on the exam will be okay, I think, with StudentRDH. But if you want to like learn more about like different air techniques, then I don't know where you find that. That's something we'd focus on,
Yes, okay. So yeah, the bulk, you can get it. And that's what we advise too at StudentRDH. I want to say this is everything. And I believe you can completely pass just using StudentRDH. But then because we're just very strict to the point and give you everything you need, on top of that, if you have some time, you can build with, the big textbooks that you have, because the challenge is big textbook from the beginning. You tried it already, right? You said you had a book. And
I had the book from the seminars from like other seniors from before, but I didn't even use it because I knew that if I started to read that book, I wasn't going to finish it. And I knew like, okay, if I have like, online stuff. I can just open my computer and use it. And, when you take the test, you're going to be staring at a computer for a really long time.
Yeah.
And if you're not used to that, when you're using the book, you're going to get a headache.
Yes, you're right. Did you feel, I mean, I preach that all the time. Go find an online format, but did you feel it on your own? Is that something you came up on your own?
Well, when I was taking the test, I was already like prepared for like online format, so I didn't find it like a problem. But like maybe towards the last 10 questions, I'm like, oh, when is it gonna be over? And then my friends came on like, oh my god, my head really hurts, I just hated it. I'm like, oh, well, I've been using this for so long on the computer, so I was like, okay.
Amazing. Yeah, you get used to the format. It's like, I mean, I always say marathon and running on a treadmill is two different things. You can't really cook a turkey if you've only been doing chicken your whole life. So just like that. And I'm happy, you were prepared. Were your eyes tired?
Oh yeah.
Yeah.
The exam, I took like a 4-hour nap because I was like, after you take such a long test, it kind of like warns you down, and you just like you're kind of like, okay, that's it. Like, I don't know how I did, and you just want to lay down.
All right. Yes, I mean, the nap sounds great. When I took my exam, I had this great idea to go out, and then it just never happened after the exam. All right, so now let's talk about, you have taken the exam, we're still waiting, but we are very confident that you did great. I mean, I look at your memory technique, that is fantastic. Now, what's your plan for you?
What's my what, sorry?
The plan, like you're going to graduate soon?
Oh yeah, so I am graduating in April, and I'm going to be completing my bachelor's degree, and then that's another 2 years, but I need to have my license before I can do that, and then I'm going to be working research in the summer. So that's my plan. I'm not going to be working as a clinician right away, and a lot of people are like, why? You'll be making more money that way. I'm like, research, I think I'll do research. That's where I want to be, and community is something that really like opened up my eye to that. So I'm going to be dealing with a lot of those index that we're talking about, hopefully.
Oh, yeah. You will see them a lot then. I mean, they are useful. If you think about it, people created a summary of because when you do community, they're just, we're dealing with a very large population. It's not like one patient at a time we have to take care of. Like, I mean, at school, we take 4 hours per patient. We got to be quick. So yeah, that's why the indexes are useful. And so can you tell us which school you're going to right now?
Right now I go to Argosy University. It's in Eagan, Minnesota.
Yep.
There we go. And then in the summer I'm going to be going to Metro State University.
Which one?
Metro.
Metro. Okay, still the same state?
Yes.
Okay.
In Minnesota. And I'm going to be working with a program called CTSI at the University of Minnesota.
And that's research.
So you're going to be, preparing me like research and give me mentors to help me understand how that works.
Wow, I love your drive. I love how you're just making your own path about, I'm going to do this versus starting as a clinician. Fantastic. In Minnesota is actually a place where they do, it's a little advanced over there for dental hygienists to be able to do a lot of different things.
Yeah, and Metro State University, which is where I'm going to be going in the summer, actually has a program where you can complete advanced dental therapy. And if you don't know, that's a master's degree in dental hygiene. So that's like my plan C if, I decide not to be just a dental hygienist.
Great. And let's talk a little bit about, the bachelor's degree you want to finish. So you said you probably graduated with a 2-year degree, and you felt the need for a bachelor's degree?
Yes, the reason why I am getting my bachelor's degree is because I've been told when I shadowed different like community dental clinics and whatnot that most employers, I think, prefer that here. But it doesn't mean that they won't hire people who have 2-year degree, but it's mostly preferred for some reason. But that's what I was told. I have no idea if that's true or not, so I can't really say that, but I felt like if I have my bachelor's degree, it will be better, especially if I'm trying to teach in the future or anything like that, because most if most places, if you're trying to teach as a dental hygienist or anything, they would require you to have a higher degree than just an associate's degree.
You are very right. And I'm glad you're making the choice. It's 2 years, 2 more years is a lot. It can be, a big investment for yourself, but in general, the level of degrees getting higher and higher. And to be very honest, if you would like to have a higher position and really be involved, it will be helpful. It's going to be an investment, but I'm glad you're choosing that. Let's say you want to be a clinician, honestly, it wouldn't matter at all. It doesn't. But if you want to do research, you have to write papers, you will have to be involved in a lot of different conferences and things like that. That will be helpful for sure. And, I encourage students to go out there and do other things than, being a clinician. In step A, you have to do it, but know that there are all other things out there, and I'm glad you found something that speaks to you, right? I mean, how did you find it when you were at school? Because this is a little unusual that you feel like, oh, at school I'm already going to do research.
It wasn't really planned until I took community, and I was just searching, like, what can I do to get a research position, and I had to look up for programs that were offered that prepare you for such career, and then I came across the program called CTSF.
I see. Great.
It's
and
research specifically.
I love it because you searched it. I mean, we cannot expect things just fall off the sky and say, hey, let's do like community together. No, like you have to approach people. You have to be proactive in getting what you want, even in the dental hygiene world, because sometimes, dental hygiene was very much clinic focused. So opening doors like this is not always easy. Yes. Now let's just, before, I let you go and thank you for all the time, I wanted to know a little bit more about tips for the students to study and to pass the boards. Not my tips, but whatever you have.
Definitely do not over study if you know something. So like, let's say you've read all of the pharmacology sections, and there are some things that you know about beta blockers, and don't spend time with beta blockers. Focus on the things that you don't know. That's the big thing. Another thing, that stuff you think are not going to show up will show up. So if you don't know it and you think it's not going to show up, then I would recommend that you actually read it and memorize it, just in case it shows up. Another thing is, like, do not try to study after 8 p.m. I think people who study after 8 p.m. will have a hard time focusing. The test is in the morning, and if you're not a morning person, just try your best to wake up early and study early, because the test is going to be early. Yeah. Another thing is develop your own memory techniques, just like, was mentioned in the course, because they really help you with long-term learning better than short-term learning. Okay. Yeah. And then definitely take the practice tests. It will tell you how fast you go. I mean, I'm pretty sure no one's going to go over the time, but it's going to help you. Right.
You're talking about the mock exam, right? And we have a timer that says, 2 hours or however much. All right. And I agree. It's always important to test yourself. You never want to do a marathon without ever understanding how fast or slow you're going. And, and I agree on everything that you have said. Whatever you don't know, that's what your focus should be, because what you know, there's no point. You already know it. Study in the morning. Okay. I'm not a morning person, and I've struggled so much. But what you're saying is that the exam is in the morning. There's no way. We cannot change the system. So if you're not used to do that, you're going to struggle a lot. That's what you're saying, right?
Yeah. I am not a morning person either, but let's say 3 weeks before the test, I started to wake up early just so I can get used to it, and I did practice questions. Again, each section that we have in StudentRDH has a little quiz that you can take. So I think that helped me, just because, if you're taking it at night, you think you're more awake, but then in the morning you'll be sleepy, and it's just not the same. That's all I can say.
I really love that suggestion. So yeah, it doesn't have to be you have to be on your desk and study for 4 hours in the morning. You can actually just start at 8 a.m. because that's kind of around the time the NBDHE starts. You can just do a quiz as StudentRDH. It doesn't have to be something crazy extensive. Just do one, one topic, two topics, and some quizzes, and that gets your mind going and your brain trained to start at 8 a.m.
Yep. And then one thing that I did like 1 week before the exam is that I read 5 sections at a time. Okay, there's 17 sections, but I did 5 sections at a time without doing the emergency, medical emergencies and medical conditions, because I already read that all the time.
Okay.
So at a time, just so I can prepare my head about like how things go. So I took 3 days to just read 15 sections, and I took a practice test, one last practice test, and a case study. So I did like a marathon. So that helped me like show me where I am, like how am I ready? Because if I wasn't like ready with the practice test, you paid like a $25 fee just to reschedule your exam. So that was gonna be my plan if I wasn't ready, but I did okay. I think I got like an 82% on the case studies practice, and then other one I got like 81% of.
Okay, you did great. You did great. So let me just recap what you have said. So you've studied with StudentRDH since August, so that's for like 6, 7, 8 months. But at the very end, very last week, you did a marathon when you just took 5 chapters per day and you just went through them again.
Yep.
Amazing. I love that. And obviously you started earlier, so that gave you a little bit of room to do all that. And that's a great suggestion for anybody who wants to study, because the last thing you want to do is rush. What about mock exam? How many times did you take it in with StudentRDH?
I didn't take them right after each other. When I first bought StudentRDH, I did a mock exam just to see where I am at.
Okay,
and I took it 3 times, and then I took a middle one after I read like the first 2 times over like all the sections. And I honestly, the first time I took it before studying at all, I did really bad. And then in the middle, after reading StudentRDH, like 2 times, I did okay. I got like 75% and 76% on the second section. And then after reading multiple times the 3rd time, which was a week before my exam, I got like in the 80s. So that was pretty helpful. Just when you take in the practice exams, make sure you don't take it right after like you already took it, because then you might memorize the answers. One thing I think that helps is that when you take in the first practice test, do not click the check part. When you click check, it shows you the answer and it does the explanation, and you don't want to know that because you'll know the answer. So do not click the check part, just keep going, and then you'll know your score. And then the last week or like the week before your exam, when you take that practice test, click the check just so you can read the explanation, and it'll help you why you got that
right or wrong.
Yeah.
Great, I love it. So in our mock exam, we have the check function, which is you can get your answer right away if you want to, but if you don't want to, you can keep going, get your score at the very end. And we have that just because everybody works differently. Some people prefer to do it the way you did it. Some people just want it right away. They want to study right away, saying, am I wrong, am I right? So we have those 2 functions, and I'm glad you're sharing your methodology, because that might work for a certain group of students. Fantastic. All right, how was dental hygiene school in general?
So we are required to like find our own patients, and that was the hardest thing ever. When I first started, I'm like, oh, I have to find my own patients. I need to complete this number of patients. How in the world am I going to do that? But I finally met all my requirements. So I was like, yes. And it's just surprising how much I grew in a clinician field. Like at first I was like not getting any surface areas out. I'm like, what am I doing wrong? How am I going to ever get to that level? But now that this is my last semester, I'm like, oh, this is so easy. I can't believe I was just really struggling with this. Like clinical wise, I think it's pretty good. It was really tough. The courses were really tough. And but I had great instructors. They were really nice. They really help you grow as a person. So I really like the school there. I made a lot of great friends that I plan on keeping for a really long time.
Yes, you make friends right at the dental hygiene school, because you go through the same journey, and that journey is not easy. There's a lot involved, right?
And then our school doesn't really do like summer breaks, so we were stuck with each other like every day. We had no choice.
Yes, and you're your program director. Her name is actually Director Arger.
Yes.
Yes, great. Okay, so I did have a phone call with her as well, I mean, email back and forth. And thanks to you, I think you really opened the door. You suggested for everybody to use StudentRDH. And, when I was on the call, it was fantastic. We are trying to do even more things to help all of you guys. You're graduating, but the next class to really prepare early so nobody fails.
Mm-hmm.
So I'm really thankful for you to suggesting everybody to get it. And just to be clear here, I just wanted to tell our listeners, our followers that you and I, we do not have a monetary relationship right now. It's not like I'm paying you to be on this video right now.
No.
Right. I just wanted to, clarify that. Really, my purpose is obviously to say StudentRDH is great, but really it's just bring your story, because I realize you're passionate about community, about research, and you are taking a path that other students may want to be interested in. And also, your tips about how to study, how to prepare are awesome. That's why I love doing those phone calls. Everybody has something to offer here.
Well, hopefully what I said is helpful for someone out there, but everyone's different. So, and then my sister is a freshman right now, so I've been telling her like how to study.
Wow.
What's working for me?
Same school?
Yeah.
That is funny.
Yeah, so I've been like helping her like study some things, and I don't know, everybody's different, but like she uses like what I give her and then tries to make her own notes out of it. So I mean, what works for some people might work for others, just modify it a little bit. So.
Wow, that would be so interesting someday if we can just do like sisters. That's the thing. You can't go through the same program, have different experiences.
Oh yeah, definitely. What I'm experiencing right now is way different than her. And every year the curriculum changes in our school, so what I go through and what books I have might be different for her too.
All right. Well, Dina, I look forward to continuing this conversation, because it seems like you want to do a lot of different things. And if you have questions, even after you graduate, it's not because you're done with StudentRDH that, you're gone. Someday we will see each other at conferences and many different occasions. And I would love to personally shake your hand to understand your story even better and to see if there's anything else I can do.
Sounds good. I look forward to meeting you.
Yes, I mean, if, just let me know. I mean, when we go to conferences, it's big, but, if you can see my face and say, hey, I remember her, that would be great. And otherwise, maybe I'm just going to pass by you and just think, I think I know this person, but, because video is always different than, real life interaction.
That's true.
Well, I wish you everything to work out for you. And if it doesn't the way you always planned, it's completely fine. Because it seems like you're a great student, you learn on the go, and you find your ways. Like you made your own memory technique, so you are very good at applying things that you learned. So I have no doubt that you're going to be successful.
I mean, I don't know if I am really great at that, but I try my best.
Hey, that's attitude is everything. As long as you know that you can do it and you try, you're going to be successful. And I can already tell from our conversation that you are extremely intelligent and you are always searching for something, that you don't want to stay still and just like, be bored. You want to look for more things. And I think you can make some great changes out there.
Thank you.
Yes. Well, I really appreciate you being on this call and sharing your story. And graduation around the corner, that's really, really exciting. So I wish you the best.
Thank you.
Yes. And, please be in touch, okay?
Oh, I'll definitely do. And I'll let you know when I pass my boards.
I know. I can't wait. I mean, those are the best moments for me when I hear, you worked out and and like your message. I think your message ordered on Facebook, right? Yeah. So
something I love about StudentRDH is that when I have a problem or any questions, I message you and like the same day I get an answer. I'm like,
yeah. Usually, I mean, I definitely try to answer within 24 hours. And, you know, Messenger also works great on Facebook. But, you know, I have my own focus. You know, I have this thing called the focus planner too. You know, I'm very focused when I work. So, and I tell students, turn off your phone when you work. And I do the same as well. So, you know, Messenger, sometimes I will not see it because I do that on purpose. Because if I sit on social media all the time, you know, I won't be able to tackle the big tasks. But I really love that. I mean, email is probably the best way to reach me. So please, you know, email me if you have anything, and then put it in the comments saying, hey, I graduated now, you know, whatever you're going through, right? Yeah. All right. So, you know, I'm going to let you go in this morning. I think it's been already almost an hour. Are you going to school right now, or what's the plan?
Yeah, I have clinic at 1, but that's fine.
Okay. All right. Well, thank you so much, Dina.
No problem.